We are OPUS Telehealth, revolutionizing how workers' comp carriers treat and interact with patients. OPUS offers remote patient monitoring for the workers' compensation industry. In our complex world of insurance claims and industrial injuries, there is a huge disconnect between the insurance carriers, the patients, and the medical providers treating the claimants.
Today, 85% of our population has at least one comorbidity. And when you translate that into the workforce, it's a huge part of our working people that have these problems. A comorbidity is basically a disease state that's in addition to our injured worker's illness. So let's say the person has a back strain that's caused by work. They may also have other diagnoses in their personal history that can complicate that low back strain. So they can have hypertension, they can have diabetes, depression, obesity. All of those things make this claim difficult to manage because they increase the amount of time it takes for a person to recover. They can already cause problems in what types of treatments the patient can have. So we call it a comorbidity because it's a diagnosis added to our injured worker's diagnosis.
If a workers' comp patient has one or more of these comorbidities or claim add-ons, then the claim times and claim costs are automatically higher, from 2 to 10 times more costly, depending on the variety of comorbid issues.
Who's going to benefit from OPUS Telehealth? Who's going to benefit from telemonitoring? It's going to be these patients with catastrophic injuries, complex claims, and multiple injured body parts.
The Bureau of Labor Statistics reported a 6.25% average annual increase in employer healthcare costs from 2001 to 2011. This adds up to an 82% increase over 10 years. A 2007 study by Duke University found that workers who are morbidly obese filed 45% more claims than non-obese workers, had almost 13 times the number of lost workdays, and had medical claims costs that are 7 times higher and indemnity costs that are 11 times higher than non-obese workers. The impact of unhealthy behaviors on these costs is significant. For example, businesses pay an average of $2,189 in workers' compensation costs for smokers versus $176 for non-smokers.
We've got all these problems. We've got people getting older. We've got people with all these extra illnesses that aren't on these claims. They're costing you money. They're costing our patients recovery time, and they're not getting our employees back to work. So what do? Well, first, we need to make sure that we're taking care of these people to the best of our abilities. A doctor only has a certain amount of time where he can interact with the patient in a visit, maybe a few minutes at most. What's going on with the injured worker when he's not in the doctor's office?
OPUS can help reduce claim times and costs by encouraging better patient compliance through daily vital uploads to our live nursing station, patient education through the OPUS telemonitoring device, and two-way video conferencing with live nurses who know each patient's specific treatment plan and health issues, thereby encouraging better outcomes for patients who present the highest cost to the system.
This prevention saves the patient's time and recovery. It saves the claims money. As a board-certified occupational medicine specialist, I have worked the last 10 years in workers' compensation with self-insured employers and saved them millions of dollars by communicating better with patients and closely monitoring treatment plans. I have decreased claim times, claim costs, and produced better outcomes. OPUS Telehealth produces better outcomes, but on a grander scale. It helps people get healthy, helps them get back to work, and it saves employers money.
OPUS Telehealth.